Can you really spot a vitamin deficiency just by looking in the mirror? Why are symptoms like rashes, muscle twitches, and fatigue not always just stress? And is it true that too much folic acid can actually weaken your immune system? In this video, we'll talk about why vitamin deficiencies happen, 16 signs that your body might be running low on key nutrients, and at the end, we'll answer some of the most common and important questions on this topic. Many people believe vitamins are just marketing or even harmful, but in truth, they only become dangerous in very high doses or when taken for too long without supervision. In all other cases, vitamins and nutrients are essential, especially for people in at-risk groups, vegetarians, older adults, people with highly repetitive or limited diets, those under chronic stress, or people taking medications, especially for diabetes or blood pressure. Why do deficiencies happen? There are a few main reasons. Diets low in vitamins, food grown in nutrient-poor soil or hydroponic systems, digestive issues that affect absorption, like low stomach acid or gallbladder problems, genetics or medications that interfere with how vitamins are absorbed. Vitamin blood tests do exist, but they're often expensive, not always accurate, and not available everywhere. That's why people often rely on physical signs of deficiency. But before taking any supplements, make sure to discuss it with your doctor. 16 signs you might be deficient in vitamins or minerals. Brittle nails could be a sign of low protein intake. Bluish tint in the whites of your eyes may point to iron deficiency or anemia. Muscle twitching or facial tics, often linked to low magnesium. Flaky or dry skin could mean you're low on omega-3 fatty acids or consuming too much omega-6. High blood pressure can sometimes be related to low potassium levels. Anxiety or restlessness might be a result of vitamin B1, thiamine deficiency. Overactive thyroid, hyperthyroidism, can be related to a lack of boron. Underactive thyroid, hypothyroidism, sometimes linked to low selenium, popping or cracking joints, can signal a vitamin D3 deficiency. Low testosterone may be tied to not getting enough zinc. Slow hair growth, often linked to a manganese deficiency. Premature gray hair may be caused by a lack of vitamin B5. Red or inflamed gums could be a sign of vitamin C deficiency. Fatigue or general weakness, sometimes due to low sodium levels. Easy bruising can happen with a vitamin K1 deficiency. Irritability, tiredness, or lack of focus. Common signs of B vitamin deficiency. Before trying any supplements, always consult a doctor, especially if you already take medications or have existing conditions. Other visible clues. A bright red or inflamed tongue may suggest B1 deficiency. A smooth tongue with burning. Possible B12 deficiency. Cracks at the corners of your mouth. Could be B2 or B6 deficiency. Leg cramps, possibly low in B6 or B3. Tingling, numbness, or weakness, often linked to B12 or B1. Poor night vision, a classic sign of vitamin A deficiency. Dry, flaky skin might be vitamin A or omega-3 deficiency. Oily or shiny skin could indicate a lack of B2 or niacin PP. If you notice any of these signs, don't self-diagnose. Talk to your doctor before taking vitamins. Frequently asked questions. Are synthetic vitamins bad? No, as long as they're high quality. Chemically, they're nearly identical to the ones found in food. What if I'm allergic to vitamin complexes? Try using individual vitamins instead of broad complexes. Can you combine B vitamins? Yes. B complexes are well absorbed together. Just avoid mixing water-soluble and fat-soluble vitamins in one dose. How long should I take vitamins? Usually 1 to 2 months, followed by a break of 3 to 6 months. The best time to take them is late winter to spring. What about vitamin B17? There's no scientific proof it helps. Its toxicity is real, so we don't recommend it. Do I need omega-3 or omega-6? Yes, if needed, for heart, brain, and blood vessels. Take them in capsule form, not oils, and only for 1 to 2 months at a time. Always check with your doctor first. The takeaway: vitamins and nutrients aren't magic pills, but they're not dangerous if used wisely. Pay attention to your body's signals: tongue, skin, nails, and energy levels. Always check with a healthcare provider before starting any supplement, especially if you have a medical condition. Still have questions about vitamins, nutrients, or your own symptoms? Drop them in the comments. We read everything and might create a dedicated video on your topic. Thanks for watching. Don't forget to subscribe, hit the like button, and most importantly, take vitamins in the right amounts. Stay healthy.